Plain extra abdomen. Can you identify small bowel or large bowel? Even experienced radiologists find it very difficult at times. Just for the sake of saying to you guys, because if you see abdominal X-ray, can you see whether it is, can you tell whether it is small bowel dilatation or small bowel abnormality or large bowel abnormality or colon abnormality? And you know, colon is all in the periphery and small bowel in the center. Okay? Here, the colon is lying in the periphery here. All the large loops are colonic loops. But invariably, small bowel do not contain air because of very high peristalsis. Okay? But sometimes it can have one or two pockets of air in the small bowel. And how do you distinguish? Now, this is abnormal small bowel. Patient is having dilated small bowel. Patient came with intestinal obstruction. Something is there in the ileocecal which is obstructing the whole small bowel. Now, small bowel is dilated. You can see here, as I said, that valvular condylarthritis, when they are dilated, they look like this. They pass through and through from one wall to another wall. This doesn't happen in colon. Remember this. It's a very important point. Whenever you find this valvular condylarthritis flowing through and through from one wall to another wall, this is small, nothing but small bowel. Another way of looking at small bowel is called small bowel enema. What you do, radiologist will put a catheter and they will pass over the first part of the duodenum, and there you will inject radium here. And it will give you an image like this. So this is called small bowel enema, where you can beautifully see the whole length of small bowel, how it is distended, is there any tumor, is there narrowing, all kinds of things can be diagnosed by this. Now let's move to large bowel. As you can see here, large bowel contain lots of circulations like this. Yes, you're right. These are called hostra. You know? One of the important finding that unlike the small bowel, valvular condylarthritis, the hostra stop short here in the middle. They do not cross through and through. They do not cross through and through. Okay? Now you can see here, you do not cross through and through. Here you can see here, but this is not a very good image. I will not say that you should diagnose large bowel from here. But from this picture, this is mildly dilated. This is not abnormal. This is not normal. I think that large bowel. You can see here, this hostra stops short here and stops short here. But you should always compare. Some of the hostras are going through like this way. This is optical illusion, I would say, more of it. You know? Somebody you should careful. Whenever you find a picture like this way, you should think that this is nothing but large bowel. This could be better appreciated in enema. Like in this enema, you can clearly see here the bowel loops. You can see the hostra, they stop short here. You can see the hostra, can you see that? Stop short here, stop short here. So they are stopping short. Whenever it stops short, so definitely it is nothing but large gut or colon. Now let's move to the another part of the body. It's called retroperitoneum. Retroperitoneum houses kidney, and kidney always wears a cap here. Remember, these two caps are nothing but adrenals. Adrenal, they look like they sit at the top of the kidneys. Okay. Now, in the plain X-ray, what do you expect to see? First of all, in the stone, you will see this area by the side of psoas. This is the kidney area, and the stone will be seen here. You know. Now, at the same time, these are the spinous processes here. These are the spinous processes. Sorry, transverse process. I'm sorry. Yes. I think. Thanks for correction. And there is a radiopaque star sitting over here. So this radiopaque star is a calculi. So as I showed in the previous image, the ureter flows by the side of this transverse processes and ultimately goes in the pelvis. So whenever there is a filling defect like that or radiopaque star substance sitting over here like that, you should think this is abnormal. This is most likely a stone. This kind of abnormality of kidneys can be best appreciated by intravenous pyelography. What is intravenous pyelography? You give radioactive iodine, or you can say iodine, injected contrast, okay? radioiodine, you inject it in the antecubital fossa, and within 10 minutes, contrast will go into the kidney to visualize the kidney parenchyma as well as the pelvic calyceal system. You know, the kidney constitutes of, you can say, periphery of the kidney, is the cortex of the kidney, and lucent side, or you can say lucent area of the kidney is called pyramids. And these are the pelvic calyceal system. And in CT scan, it looks like this. There's a bean-shaped structure here, clearly seen, beautifully demonstrating the renal cortex and the low attenuated area, the pyramids, and you can see here adrenal sitting like a cap here at the both top of both kidneys, right? This is the early, you can say, nephropathic phase, and this is the excretory phase. That means at this phase, when you take an X-ray, you'll find the quality will be like this. Okay, clear to all of you? Now, let's go to the pelvis, the last part of my almost lecture here. Pelvis is one of the important structures. Many times patients will come with the pelvic pain, and whether male or female, most of the female or male reproductive area are sitting housed inside it, along with colon as well as appendix. You know, appendix, fallopian tube, urinary bladder, ureter, urinary stone, all these things would come in the pelvic area. Okay? And rectum, as I say. So obviously the sacroiliac joint is sacrum, and here is a pubic rama here on both sides, femoral head, and you can see a acetabulum here. Okay? So anyway, you take a pelvic X-ray, you find a pear-shaped structure like this. Don't get scared by looking at it. Is it abnormal? Is it a mass? No. It's a normal shadow of a urinary bladder. Okay? Urinary bladder with surrounding fat, they look like this. So this is quite a normal shape of a urinary bladder. Now here, what is happening? Here you can see multiple stones sitting over here. Where the stones are? These are all inside the urinary bladder. Okay? Patient coming with severe pain in abdomen, or he would complain while passing urine, I feel pain, then he'll do an X-ray and you'll see findings like this, and straight diagnosis is a bladder, urinary bladder stone. And here is a lady coming with pelvic mass. What is happening? This mass is causing lifting up of the bowel lobes. Can you see that? Pushing the bowel lobes upward. So this is a big mass sitting over in the pelvis. So these masses normally they could arise from the uterus because of the uterine fibroid, or they could be ovarian malignancy, you know, ovarian tumor, ovarian cyst. Okay. So these are the things normally happen. And in normal patient, a pregnant lady, suppose accidentally if you do an X-ray, you can see the bowel lobes are dilated, or you can say big uterus can push the bowel lobes like this way. Normally you do not do X-ray in the pregnant lady, but if you do it accidentally, sometimes you can see a normal patient also. Now last but not the least, and here this is called hysterosalpingography. That means you inject contrast from below in a lady, and you can see here, this is cervix here, when you see the visualization of the uterus here. Uterus is a triangular structure here, and the thin lines that you're seeing here are fallopian tubes. When we inject contrast into it, then fallopian tubes, and it goes to the fimbria, and it spills over to the peritoneum here. So this is a normal, you can say uterus and fallopian tube. So whenever there is any block here in this area, and we say this is a problem with the fallopian tube, many times because of these, inflammatory conditions, the fallopian tube can be blocked, or there could be ectopic pregnancy, or there could be tuberculosis. All kind of things can lead to blocking of the fallopian tube. So in a nutshell, I think I've shown you a brief idea of the abdomen, how you could have an idea by looking at the plain X-ray. In the next lecture, I'll be giving more specific, I think, the description of CT scan and disease-related conditions, how hepatitis look like, how a hepatic cyst would look like, how pancreatitis look like, and how a pancreatic tumor would look like, all kinds of things. So till that time, I think if you have any question, you can ask me. You're happy, all of you? Yes. That's great, brilliant.